Dear audience, let me present my progress on my PhD topic, metabolic changes in pancreatic disorders. I'm Mónika Lipp, a PhD student and a gastroenterology resident at Semmelweis University, and my personal vision is to take action on the quality of care. Here you can see our ongoing projects. In our first project, I would like to detect the association between fatty pancreas and pancreatic carcinoma in a form of systematic review and meta-analysis. In our second plan, we try to understand the connection between metabolic changes and the pancreatic disease progression. Let me talk about the background of our first project. It is known that pancreatic cancer takes the first place among asymptomatic cancer worldwide. And I would like to highlight that only 10 to 17% of the patients will live 5 years after the diagnosis. It is known that pre-existing metabolic disorders can contribute to the development of pancreatic cancer. And it is also shown that fatty pancreas somehow plays a role in this project. But what is fatty pancreas? Fatty pancreas is a fat infiltration to the pancreas, mostly due to obesity, presented in 30 to 35% of the patients. Our aim was to detect the association between these two entities. Let me talk about the imaging techniques. In general, we can say that 6.2% fat infiltration of the pancreas causes normal. The gold standard diagnostic method for pancreatic fat content is histology, but it's a mostly invasive technique. That's why the vast majority of the studies used EUS as a diagnostic method. Some of them used CT and only one of them used MRI. Our clinical question was that if fatty pancreas predisposes to the development of pancreatic cancer or not. We included patients where the intrapancreatic fat deposition was determined based on modern radiology or histology, and our main outcome of interest was the prevalence or the ratio of pancreatic cancer, with the hypothesis that fatty pancreas increases the risk of pancreatic cancer. After our systematic search and selection, we ended up with 17 eligible articles for our meta-analysis. We conducted our systematic search and selection in 3 main databases, with the final search key you can see below. And let me present our results. Here we investigated the presence of pancreatic cancer among patients with fatty pancreas. Early detection is highly important, because patients mostly present at the late stage of the diagnosis. Here we investigated that how many fatty pancreatic patients had pancreatic cancer in the case and in the control group. We used odds ratio with 95% confidence interval. Prospective and retrospective, cross-sectional and case control studies were included. The odds of having pancreatic cancer when a patient has fatty pancreas was 32%, which could be clinically relevant, but not surprisingly, it's mathematically not significant, because fatty pancreas maybe later can progrediate to pancreatic cancer. That's why we changed over the question to see the real connection. Here, we investigated the presence of fatty pancreas among patients with pancreatic cancer. It wasn't just 32%, the odds was more than 6 times higher compared to the control group. It's clinically relevant and it is mathematically proven as well. Here we investigated the proportion of fatty pancreas among pancreatic cancer patients. You can see that the heterogeneity was quite high, because sometimes they included patients who underwent EUS for various kind of hepatobiliary indications, and in the other case they included patients who underwent pancreatectoduodenectomy for pancreatic carcinoma. But we can say that the proportion of fatty pancreas among pancreatic cancer patients was 62%, which means that we can find fatty pancreas in more than half of the pancreatic cancer patients. The strengths of our meta-analysis were that we were able to strengthen the connection between these two entities and we examined the relatively large patient populations. However, we had to deal with some limitations, for example, the heterogeneous patient population and the mostly retrospective nature of the studies. In conclusion, we can say that fatty pancreas predisposes to the development of pancreatic cancer. The implication for practice is that the measurement of the fatty pancreas should be included in the routine radiological examination, and the standardized definition for fatty pancreas should be unified. The implication for research is that, for example, further prospective observational studies should be carried out in this topic. Here you can see the status of our manuscript. It has been submitted and currently it is under review in the Journal of Cancers. And let me talk about our second project on metabolic changes and pancreatic disease progression. We already know that metabolic syndrome plays a huge role in the development of acute pancreatitis, but we don't really know what happens after an AP episode, how the metabolic syndrome can contribute to the development of severe pancreatic diseases. For example, the recurrence of the acute pancreatitis, chronic pancreatitis, or even pancreatic cancer. GOLASH is a trial where patients is admitted based on their acute pancreatitic episode, and they are randomized to high or low energy arms. GOLASH Plus is a follow-up study of the GOLASH trial where patients should come back in a regular basis. I would like to highlight that on admission and peak in-hospital glucose levels are independently and dose-dependently associated with AP severity and mortality. On the right side of the slide, you can see that BMI above 25 increases the risk of severe AP, while BMI above 30 increases the risk of mortality. Our aim was to detect the different parts of the metabolic syndrome and how they contribute to the development of these pancreatic diseases. We wanted to know that what are these factors. We included patients from the GOLASH trial, and our main outcome of interest was the ratio of newly developed pancreatic diseases. The implication for practice was that we would like to prevent or detect at an early stage these contributing risk factors. Here you can see that more than 300 patients were included after the acute pancreatitic episode, but there are less patients come back to the follow-up. I would like to highlight here that the on-admission labor parameters based on the preliminary data could be high. For example, the hemoglobin H1C is elevated in 70% of the patients, and the cholesterol is elevated in 60% of the patients. Here you can see our progress. Currently, we are ready with the first data retrieval and also with the quality check, and we are in a constant consultation with our statisticians. As a summary, I would like to highlight that we will be able to strengthen the connection between fatty pancreas and pancreatic carcinoma in the form of systematic review and meta-analysis. And in our second project, we try to understand the connection between metabolic syndrome and the pancreatic disease progression. Well done is better than well said by Benjamin Franklin. Thank you for your attention.
You mentioned that there were some articles which histologically the confirmation was also made. So what was the conclusion if you are grouping those articles which were really histologically based fatty infiltration of the pancreas? Was the correlation stronger, or can you say anything about it?
Thank you for your question. We only have one article which used histology as well, and they used autopsies. So that's why they had to choose for a control group like cadavers who hasn't had any pancreatic diseases, but they used this data with other cancer types. So we have only one article with these histological samples.
Fatty pancreas without obesity. Is there fatty pancreas without obesity?
Yes, but mostly with obesity.
And which is worse from the cancer risk point of view? Am I getting more likely a pancreatic cancer if I'm fat and I have got fatty pancreas, or do I get it more likely if I just got a fatty pancreas and I'm not obese?
We wanted to do a subgroup analysis based on the BMI, but we haven't have enough data to be pulled. But I can say that based on other research connected with obesity, you have a higher chance to have fatty pancreas, and in that way you have higher chance for pancreatic cancer. So I can encourage everyone for healthy eating and a good lifestyle.
And that leads on to my question, which is a mean question. Is the systematic fat which leads to cancer, is it the local fat in the pancreas which leads to cancer? And what is the potential pathomechanism of fat and then cancer?
I can say that when you reduce the visceral fat content, your pancreatic fat content will also decrease. But that's why further prospective studies are needed, because we don't really have enough data based on these entities. So, but we can see that there is a chance to reduce pancreatic fat as well.
So, congratulations, and I would like to ask you whether in these articles that were investigated exclude patients with chronic pancreatitis, as these patients are prone to developing pancreatic cancer.
Thank you. So some of the articles also collected data about if the patients had chronic pancreatitis, but there were studies where they excluded these patients at the first step. So we weren't able to do subgroups based on that, but you can see that we have only 17 articles. So it's we can say a new topic, and we needed further studies where we have more data about how the chronic pancreatitis can contribute to this fat content.